Hello and welcome. I'm Jeff Spence from the Office of Alumni Relations at Thomas Jefferson University, and I want to thank you for joining us this evening. Tonight, our speaker, Dr. Elizabeth Jones, will discuss with us the effects of aging on the health and appearance of our skin and explore some of the topical and clinical treatments meant to enhance our natural complexion. We'll also have time at the end of the program to address your questions. We did receive a number in advance, and we'll do our best to get to them as time allows for us together. So let's get started by welcoming Dr. Jones, a 2013 graduate of Sidney Kimmel Medical College, and in 2017, chief resident at Thomas Jefferson University Hospital's Department of Dermatology and Cutaneous Biology. Dr. Jones currently serves as an assistant professor in dermatology and director of teledermatology at Jefferson. Dr. Jones, thank you for joining us. Take it away.
Hi, everyone. Thank you so much for joining us tonight. I'm going to go ahead and share my screen. Okay, so this talk is how to put your best face forward. It's going to review skincare and aging. This is so important because I'm doing skin checks all day long. And frequently, once we get to the end of the visits, patients ask about what they can do to enhance their skin health, what kind of products we recommend. And, it's a common question that we get. This is a huge concern for a lot of patients. And it really takes an in-depth look at what ingredients are in the products and what's out there. So the whole point of this talk is to give you more of that well-rounded discussion on what options are available to you and how you can enhance your skin health. So I'm just going to here. So one thing that I wanted to address is this fear of aging that I frequently am, getting from patients. They cringe when getting their skin checks. They say, well, I put this off because I really couldn't stand the thought of having somebody, analyze my skin and look me head to toe. I have all these age spots, or I remember when my mom or my dad had these spots, and I can't believe how I look on Zoom. And there's this new idea of Zoom dysmorphia where people are noticing how they look when they express themselves, and they're starting to be concerned about things that they see. And I also want to talk about this whole idea of aging naturally. I think a couple years ago, we sort of had these unrealistic standards that were being put out by magazines, Hollywood celebrities, social media. So first of all, celebrities and actresses, actors, they have teams of people working on them day in and day out. They're spending thousands of dollars, on their appearance. But then we see these people day in and day out on TVs. And so this is creating, a standard that we go off of what we think the idea is of what we should look like. Also with social media, we have all these filters to enhance our skin tone or our appearance. And, really this has created a lot of pressure to go towards some sort of perfection or creating unrealistic standards and at times often unnatural standards. Also, marketing creates a lot of hype around products. You'll frequently see things like use this product and in 2 to 4 weeks, it's going to completely change your skin or reduce wrinkles. And that's just not realistic. There's also so many products to choose from. So where to start? We have all gone into the drugstore and said, okay, I'm going to start fresh. I'm going to use a new product. But once we start walking down the aisles, we're overwhelmed by everything looks like it says anti-aging or anti-wrinkles or skin brightening. So what's really going to work? And also we all talk with our friends. So what worked well for a friend, may not work well for you. Everyone's skin type is different. We're all working with a different gene pool. And so, we all have that friend with perfect skin who uses one product. And there are vast differences, between us in dealing with how products are going to affect our skin. So I just wanted to go over historically, what the advertisements have done. So this is probably from the 50s, 60s, amazing discovery, ends wrinkles. Nowadays, we often have these side-by-side comparisons. And again, here, ends wrinkles, only 60 minutes. And if we look at this on the next slide, we see that, we now have graphic design artists who are, again, creating these digitally enhanced photos with side-by-side comparisons of somebody who looks young versus somebody who looks old. And this isn't necessarily representative of a true person. It's more of that digital enhancement and that computerization of these images. But this is commonly used online. These are 3 different products with different labels, all claiming to be anti-aging topical treatments, but using the same kind of marketing strategy. So again, an unrealistic advertisement with an unrealistic standard. So the goals of this talk is to help you understand the skin signs of aging, emphasize that our skin changes over time. And, this is a reality that we're all going to go through. And there are definitely things that we can do starting at a young age, but throughout our life that can help prevent the skin signs of aging and also help reduce the signs of aging. So I want to empower you as a listener tonight to have the knowledge to really search for the active ingredients. So not go by just what's on the front of a bottle or product, but really be able to turn it around, see what the active ingredient is, and know what that's going to do for your skin and if it's a good product for your skin. Again, we're going to be avoiding those unnatural results and setting realistic expectations for ourselves too. So let's just go through what causes the aging face. And at the very top, we have UV radiation. We know that the more exposure we have, especially unprotected exposure to the sun, the more this can accelerate the aging process. And also unhealthy habits like smoking is certainly going to accelerate this further. Naturally, we do have over time a breakdown of collagen, which gives our skin strength, and elastic fibers, which gives it the ability to stretch and go back to where it was before it moved. So we have that breakdown over time. We also have a loss of natural moisturizing factors in the skin, which makes our skin more prone to dryness and irritation. Repetitive motion of facial muscles, which will eventually create wrinkles. So they start as dynamic wrinkles, which are wrinkles that are apparent only when we make certain expressions, and these transition into static wrinkles, which are wrinkles at rest. We also have facial fat pads that work in motion with our muscles. These cushion our skin, protect our skin, but the volume of fat in these fat pads changes and atrophies over time. So that can create a little bit of contouring of our cheeks. It can also create a little bit of hollowing under our eyes. And this is going to affect, what our skin looks like, especially on our face over time. And there's bone and cartilage resorption. So we do have a little bit of recession of our chin, and it can create an elongated appearance of our nose with a little bit of proptosis, or what appears as the nose sticks out a little bit more over time for a lot of people. So let's review just a couple examples of skin signs of aging. We're all familiar with these, but the medical term for wrinkles is rhytides. A lot of patients are concerned about the horizontal wrinkles on the upper forehead, the vertical lines between the eyebrows, and then the crow's feet around the eyes. Lentigines or solar lentigo, these are sunspots, and this is our body's way of producing more melanin in our skin to protect it as a reaction to chronic UV exposure over time. So we are frequently refer to these as sunspots. There's also seborrheic keratoses. These are extremely common. Most of us have these because there's a strong hereditary component to getting them. And some professionals, dermatologists may refer to these as age spots, or less eloquently as barnacles, which some patients laugh over and some are like, oh, that doesn't really sit well with me. But these are extremely common. And there is poikiloderma. This is the mottled pigmentation. More fair-skinned patients often get on their neck, around their chest. So often in areas that aren't necessarily protected by our clothing, that see a lot of UV radiation over time. And also dryness is common. As I said before, we lose our natural moisturizing factors in our skin. So dryness, increased laxity, thinning, and easy bruising can happen with this breakdown of collagen, not just in our skin, but also in our blood vessels over time. So the first half of the next portion of this talk is really going to focus on topical treatments. And then we're going to cover more procedural aspects of treatments for the skin. So let's get into the topical treatments next. So the first thing to cover is face washes. Now, historically, we used to have very harsh soaps and also harsh water. So the idea in the past when soaps were first created was that they were very strong, more antibacterial, and they created a lot of soap scum. So what a lot of people did was they would purchase an astringent to help wipe off that residue and that scum that was left by the soap. Well, as soaps have become more gentle and now we have treated water, this is something that's really irrelevant now, but it's been carried forward from prior generations. So a lot of people think that soap actually has to give you a tight feeling to get a deep cleanse and to think that it's working. But that's a myth. And realistically, a lot of soaps that are going to give you that tight feeling really means that it's a little too harsh and drying for your skin. Things to also avoid include harsh exfoliators and toners. So with the exfoliators, you often see these micro scrubbers or microbeads. And this is really mechanical abrasion of the skin. If at all, I say use it no more than once a week if you really like these products, but not something to use on your skin every day. And toners too, a lot of them do have things like alcohol, witch hazel, or irritating preservatives in them that can irritate the skin more than help it. So I caution against toners. And for most people who are just looking for a simple face wash to get rid of that dirt and oil buildup, you're looking for a gentle cleanser or cleansing lotion. This tends to work well for all skin types. Now, I'm not talking necessarily about people with acne prone skin. That's a different story. But gentle cleansers really work well for a lot of people. And then let's talk about moisturizers, another common question I get from patients. So moisturizers for the face, first of all, you do want to find a moisturizer that is labeled for the face. And also on the label will say either oil-free, non-comedogenic, or won't clog pores. This is all the same thing, meaning that it's not going to cause acne. So certainly you don't want to be using moisturizer that's creating another problem for you. And there are two key ingredients that I tend to recommend. So again, you're going to be turning around the bottles or the product to look at those active ingredients. And one great ingredient is hyaluronic acid. So this is a larger molecule that when applied to the skin, it tends to help. It's super water retentive. So it helps you retain that water and gives you a nice plump feeling to your skin. And it helps your skin retain moisture over time. The other thing is dimethicone. This is great for people with sensitive skin. It's not going to irritate your skin. It's non-comedogenic and hypoallergenic, and it's very soothing. So it's great to use as a moisturizer, especially if you have sensitive skin, dry skin, rosacea, if you're coming right out from being out in the sun all day. So moisturizers with these two ingredients are great. Also, for the body, the thicker the better. So ointments are the best. The gold standard is, stale petroleum jelly or Vaseline. It's our secret weapon in dermatology. You can also get something very thick like Aquaphor. But a lot of people don't like that really greasy feeling, and it's actually a lot of work to rub that into your skin. So creams and oils are then preferred. There's also something called wet skin moisturizers. This is great for people who are busy, and they're like, realistically, I'm not going to be lathering my skin every single day. I'm in a rush. So this is great. You keep it in your shower. Right after the shower, your skin's nice and damp. You apply a thin layer of the wet skin moisturizer, and then you just pat dry right after. And it absorbs well, and it's not a whole extra step. So it's really easy to incorporate this. You also want to avoid lotions. In general, lotions are the best selling products, but they have a lot of water and alcohol in them that thin them down and sometimes even dry out your skin. And sprays, a lot of the product ends up going elsewhere rather than hitting your skin, and it often goes on fairly thin. So the thicker, the better for your moisturizer. It is important to moisturize regularly. I can't tell you the impact that this has on my patients. When I do skin checks, I can tell who regularly moisturizes and who doesn't. And it does create a nice glow to the skin. It makes the skin look more healthy, and it's more resilient to breakdown, itch, as well as injury if you continuously moisturize your skin. But again, this is something to do on a regular basis to get the best benefit. Now, the next thing I'm going to talk about will answer most of the questions that I got about this session. So this is one of the key takeaways, the ABCs of facial skincare. And this is, if you're looking for a place to start with starting a regimen, it's these key 3 steps. So A stands for vitamin A derivative, which is retinoids. And we'll talk in depth about the different kinds of retinoids and which one might be good for you. B is broad spectrum sunscreen. If we're talking about anti-aging and protecting your skin, from the sun, we absolutely have to incorporate sunscreen into our daily routines. And vitamin C, this is something that has become much more in vogue in the past couple of years. It's a very natural ingredient, so a lot of patients love using it, and it's a great product. So combining these, you're protecting your skin's health, you're preventing damage to your skin, you're also getting that anti-aging benefit. These products brighten your skin. So these 3 steps are key. So let's look at the makeup of our skin and the anatomy of our skin. And this shows layers, including the very top layer, which is just dead keratinocytes or skin cells. So these are shed. And then you have the epidermis here, and you have a layer of basal cells. And the bottom layer is where these new epidermal cells or keratinocytes are produced. So they slowly work their way up. So from being a fresh new cell to shedding off of your skin. And this process takes about 4 to 6 weeks. So I always tell my patients, give any product that you start a good 4 to 6 weeks to kick in, because that's when you have freshly, treated skin that's fully been treated. It's coming up from the bottom layer up and it's been exposed to that product the whole time. So that's really where you're going to start to see the impact of any topical. So anything that claims to make a huge impact in 2 weeks is probably false. You need at least a month of using a product. So once we get below the epidermis, we hit the dermis. This is where we have collagen. And in between the collagen, we naturally have that hyaluronic acid. So again, it's super water retentive. It offers cushioning to our skin and protection. We also have free nerve endings, blood vessels, so arteries and veins in our dermis. And then underneath the dermis, we have fat for cushioning, protection, heat insulation. So retinoids, what's the hype about retinoids? What is a retinoid? Again, this is a natural or synthetic derivative of vitamin A. And what retinoids do is they help with skin cell turnover. So you're shedding those dead keratinocytes and you're increasing the epidermal cell turnover and replication. So you get this nice appearance of fresher, healthy cells with that increase in skin cell turnover. You're getting rid of the dead keratinocytes, which can create more of a dulled appearance. Also, because it's penetrating through the epidermis and hitting the dermis, it stimulates collagen renewal and thickening. So that's really where you get the reduction of fine lines and wrinkles. But that requires prolonged use. And we're talking a couple months. So a good 3 to 6 months at least of starting to get to that smooth end appearance and getting to some of that texture change. Retinoids are also, because they're a derivative of vitamin A, they're an antioxidant. They help reduce UV-induced damage. And they inhibit the production of skin pigment. So they can be brightening. They can brighten those sunspots or solar lenticos or lentiginous. They can also just offer lightening to the spots that you already have. So choosing the right retinoid, where to start. So I always recommend, if you haven't done a retinoid before, and by the way, retinoid is an umbrella term for retinols, which typically are over the counter. These are not as strong as the prescription strength retinoids, which we'll talk about too. So if you're going to start with an over-the-counter option. The reason why these are available over the counter is because they tend to be better tolerated. So lower side effect profile. Commonly, the active ingredients that you're going to see, if you're just going for an anti-aging product, is going to be either retinol or retinaldehyde. So that's going to be the ingredient on the back of the bottle you're looking for. These, when they're over the counter, they are 20 times less effective than the prescription tretinoin, but a great place to start because they're better tolerated. If you're looking more to treat acne plus get that anti-aging benefit from a retinoid, adapalene, which is listed here under retinoid-like alternatives, this is a great option. This actually used to be a prescription only. It was released over the counter a couple of years ago. This is very good because a lot of retinoids are sun sensitizing. So they do make you more prone to getting a sunburn or photosensitivity in general. So adapalene does not have as much of that kind of effect. So it's great for young teenagers who are outdoors, who have acne, who want to clear up their acne, and also younger patients who are just as active, who want a prevention anti-aging benefits from a young start. So adapalene is a great product as well, if you have oily skin too. Then let's talk about a retinoid-like alternative. So this bakuchiol is a great ingredient. There's been more recent coverage of this ingredient because a lot of people are looking for these more earthly, natural over-the-counter ingredients. So bakuchiol has a lot of effects on the skin similar to the retinoids that we covered on the last slide. But this is derived from a plant and it's actually safe during pregnancy and lactation. So historically, we had to pull the use of these topical products from patients when they were family planning, pregnant, or lactating, but now they can go to bakuchiol. So it's great to have that coverage during those years. Now, when we talk about prescription strength, tretinoin is really our workhorse. Tretinoin comes in a gel, it comes in a cream. So gels are good for oily skin, creams are good for more sensitive skin where you want a moisturizer, and it comes 0.025, 0.05, and 0.1%. So we usually start at a low concentration with the cream, and we work our way up. If you still have a lot of oil production, we'll switch to a gel. And again, this is our workhorse. We use it all the time. It's great for acne, but it's also great for anti-aging. So once you've proven that you've tolerated an over-the-counter retinol, you've done that for about 2 to 3 months, you're ready to go to the next step. Usually the active ingredient in the prescription is going to be tretinoin. They did just come out with a lotion form also for tretinoin that is very well tolerated. Now, if you're looking for the biggest gun that we have, this is going to be Tazorac, or tazarotene is actually the active ingredient. Tazarotene is very strong. So a lot of patients, regardless of how tolerant their skin is, they do get redness from this. So, it's not the best for sensitive skin. It's not the best for somebody with rosacea. But if you have tried all the other options and you still think you want some improvement, you can go to Tazorac. But this is, for somebody who needs to be moisturizing, very well with the use of this medication, and they need to make sure that their skin is tolerating it okay. So that kind of summarizes the retinoids that are available to you. Again, always start over the counter if you haven't done any in the past, and then you can come to us as your dermatologist if you're ready to start a prescription strength. The key tips for success with retinoids. So a couple things, you want to apply at nighttime because these are deactivated by the sunlight. So it's key to apply it at night. You also want to start every other night. A lot of people get really excited. They're going to use their retinoid. They apply it thick like a mask. And then the next day they wake up and they're bright red and they're really itchy. So start every other night and really use a pea-sized amount to your entire face. So it should be a thin film that's easily rubbed in, and you don't want any residue left, on the surface of your skin. Slowly work your way up to nightly use over about 2 to 4 weeks. And again, don't force it. If you wake up the next morning and you say, oh my gosh, my skin's kind of red and dry, skip that night and then restart the next day. You want to be moisturizing as soon as you start a retinoid because this helps reduce any of the side effects like drying and itching. You also want to protect your skin with sunscreen because again, most of them do make you a little bit more sensitive to the sun, higher risk for a sunburn, and the benefits take weeks to months. So again, a lot of patients call me and they say, I've been using, what you prescribed for about a month and I'm really not seeing that much change. And we kind of go over, okay, this is where you can start to see improvement, but it really takes a couple months to get the full benefits of these products. Now, I'm going to talk about sunscreen. And this is very important for any kind of skin regimen. We can't underestimate the value of sunscreen. So a couple key things to look for in your sunscreen. And again, with this talk, I want to avoid emphasizing certain product lines or certain names because really these all come at different price points. So it's going to come down to your knowledge at the end of this of knowing what you want to look for to make sure that it has in that product, and then what kind of price point you want to go to. So this is going to give you the knowledge to know if a specific product is good for you. So for sunscreens, SPF 50 or higher is important. This will offer you prolonged protection against sunburn. Water resistant are great. There is no such thing as waterproof sunscreen, but they are water resistant. They can cling to the skin a little bit better than those that are not water resistant. And there's usually a 40 or 80 minute option. With water resistant formulations, you do want to give it a full 20 minutes to absorb before you start sweating or going in the water so that it's fully embedded in your skin and you get that protection. You also want broad spectrum on the bottle, so it covers both UVA and UVB. So UVB is more closely tied to skin cancers, UVA to skin aging, but both of them can be causative of both problems. Creams are better because they do provide more protection. They rub in nicely. You want to apply a shot glass size to your entire body. So it's actually a decent amount of sunscreen that you want to be applying to get that complete coverage. And then we break it down based on mineral sunscreens and chemical sunscreens. So let's look at that more closely. So physical or mineral sunscreens, these act as a shield, meaning that the sun is reflected off of your skin without being absorbed. So this is the zinc and titanium, and these are very popular. They've become more popular over time. Zinc is the age-old ingredient in sunscreen. So when we classically think of zinc sunscreens, we think of this picture, that lifeguard with the white nose, because zinc historically left this kind of white cast on our skin. But now they do have transparent nanoparticles, sheer formulations of zinc that absorb nicely for all skin types, which has been a great advancement in the application of sunscreen. Zinc and titanium are also great for sensitive skin. Now, chemical blockers act a little bit differently. They act as more of a sponge. So instead of allowing your skin cells to absorb UV radiation, the chemical blockers will absorb that UV radiation. I listed a couple of the examples of the chemical blockers that you're going to see in those active ingredients. These are really great because they're easy to rub in, so they don't leave a cast. It's easy to apply. There have been some questions about the safety of sunscreens, and we have no robust data to show that these are harmful. But we have new data to suggest that perhaps we are absorbing these into our bloodstreams at higher levels than realized before. So they are doing kind of safety testing on this. And also specifically with oxybenzone and octinoxate, these are ingredients that if you're concerned about coral reefs, because it's found that these can create accelerated bleaching of the coral reefs. And this may be something that our government is actually going to step in and put restrictions on the uses of these kind of ingredients in sunscreens in the future. So something to consider. But nowadays, a lot of people are shifting back to the zinc and titanium, physical blocking sunscreens. And this is also great for babies, 6 months and older, and younger children with sensitive skin. So this is the American Academy of Dermatology. They do recommend, again, broad spectrum, SPF 30 or higher, water resistant formulas. I typically recommend SPF 50 or higher. I think it offers a tad bit prolonged protection for people. And I think that people tend to forget to reapply. It is important to reapply every hour if you're active or in the water, or every 2 hours if you're just lounging outside. So vitamin C, a lot of people are excited about vitamin C. It offers a lot of benefits. Another term for vitamin C is ascorbic acid. But vitamin C offers photoprotection, does enhance collagen synthesis, and it lightens hyperpigmentation. So again, with that collagen synthesis, this takes prolonged use, but this can help reduce fine lines and wrinkles. It helps with brightening, and it helps prevent that redness, from being out in the sun because it's an antioxidant. The issue with vitamin C is it's actually very difficult to get into a formulation that's well absorbed into the skin. And we know that vitamin C breaks down when exposed to light and air. So chemists have gotten really creative and really clever with creating more resilient formulas. But you do want to avoid purchasing a see-through bottle. So it's really important to purchase a bottle that protects that vitamin C, that's going to be active for a while, and not break down, so that when you're applying it eventually over a couple of months, it doesn't weaken to the point where it's ineffective. Other names that you may see on the active ingredients is L-ascorbic acid and this tetrahexyl diesel ascorbate. So there have been a couple studies with these two ingredients in particular that suggest certain percentages. Oftentimes the percentage I find is not actually listed on the bottle. But we know that these two ingredients in particular are very effective in terms of the type of vitamin C that you're going to purchase. So I just want to rehash the ABCs of facial skincare. And again, if you were kind of tuning in tonight to say, okay, where's my starting point? This is it. So a typical regimen would be in the morning, you wake up, you're going to wash your skin with that gentle cleanser, completely pat dry, and then apply a thin layer of topical vitamin C. Then you can go about your day, apply moisturizers or makeup with SPF 30 or higher. And you want to make sure that those moisturizers and makeups are oil-free and non-comedogenic, so they're not going to cause acne or clog your pores. And then at nighttime, you want to go ahead and wash. Again, you can just use a gentle cleanser to get rid of the dirt, oil, dead skin cells that have built up over the course of the day. Pat completely dry, and then apply a thin layer of your retinoid. You want to make sure that when you're applying your retinoid, your skin is dry, because that helps with the absorption. And then moisturize. Be proactive about your moisturizer, even if you have oily skin. As long as that moisturizer is oil-free, it's not going to clog your pores or cause acne. Now let's go to a couple extras. So alpha hydroxy acids, these are great products, and what they really do is they reduce scaliness and roughness of the skin. They also help it increase exfoliation. So they create this nice smooth feeling and a nice glow to your skin because they offer lightening and brightening as well. With prolonged use, again, you get that enhancement of collagen production to reduce fine lines and wrinkles. And the key example ingredient here is glycolic acid. A lot of you may have heard of this. But other examples are citric, lactic, pyruvic, mandelic, and tartaric acids. So these are all great products. So alpha hydroxy acids really help reduce scaliness and roughness of the face and increase the smoothness of the face. Alpha hydroxy acids actually work more on the bottom layers of the epidermis. So some people do notice stinging and burning. This doesn't mean that your skin is too sensitive for it. It's just how the product works. Some people can get a little pink from these, but oftentimes they come in about 5 or 10%. You can get it as a wash or a leave-on serum, but generally these are very well tolerated. Now, beta hydroxy acids, these are a little bit different. These target oil. So they induce exfoliation and they're able to get down into the pores, and they're absorbed actually by the oil gland within the pores to reduce the oil there. So it prevents your pores from getting clogged at the top, and it also reduces the oil production. So this is great for patients who also have superficial acne. It's even used in high concentrations, like a 40% concentration for warts. And we also use it, there are salicylic acid-based shampoos for things like dandruff. So the key ingredient here, the key example of a beta hydroxy acid is salicylic acid. And the nice thing about this is it's less stinging, but it can be more drying. So you do want to be using a moisturizer with this product to get ahead of the side effects as well. Niacinamide or vitamin B3. A lot of attention has been given to this ingredient in the past 5 to 10 years. And what we found about niacinamide is it improves skin hydration and barrier function. It also reduces redness and reduces sensitivity. So if you have rosacea and you're looking for an add-on ingredient to incorporate in your regimen, this is a great product. It's also really good for patients with acne. They're also putting this into sunscreens to help protect skin and reduce that redness that you get when you go out in the sun. Niacinamide enhances skin tone and radiance. And again, prolonged use, you get reduction of fine lines. You do want to look for a 4% or higher if there's a percentage listed on the bottle. Vitamin E has been around for years. We have potentially had grandparents and parents who have told us, go ahead and apply, vitamin E to that burn or that scar that you have. But actually what they're telling us is true. We found this helps with skin repair, wound healing. It's anti-inflammatory, and it's an antioxidant that protects our skin from UV radiation. So we're finding more frequently that product lines are combining this with vitamin C to get that improved photoprotection. So it's a great add-on. And a lot of people, again, are looking for more plant-based natural ingredients. A lot of these ingredients have an active component, which is a phenol. So for example, there's black, white, green tea, soja, grapes, berries, resveratrol. These are all examples of phenols which act as antioxidants. So they protect your skin from free radical damage, from sun exposure, reduce redness. And actually, when we looked topically at different types of teas that help protect collagen and elastin, white tea seems to be outperforming green tea. I think green tea is easier to market because a lot of us are just familiar with this as either a supplement or a drink. But really, topical white tea has been very promising. Resveratrol is also promising. The good news is this is in grapes, grapefruits, nuts. Ferulic acid is also something that we see combined with vitamin C and vitamin E to be photoprotective. So often, sometimes these are the sole ingredient in a product, but oftentimes these kind of add-ins, help just enhance that photoprotection. And newer products include peptides. We know that peptides can help reduce inflammation and antimicrobial defense, but there are all kinds of peptides out there. Some of them are being formulated to be more anti-aging and help smoothen fine lines, but this is an active area of development. And they're widely variable in products, so it's a little hard to give, strict guidance on exactly what kind of peptide to look for at this point until we get more information. The last thing I wanted to touch on in terms of a key topical ingredient is hydroquinone. A lot of you are familiar with this because this is a skin lightening agent. It's really only supposed to use as a spot treatment. So all of the prior products and ingredients that we talked about can be used to treat to the entire face. But hydroquinone is something you have to be careful with. You only want to apply it to darkened areas. So some people will use it for melasma, some people will use it for sunspots. Or darkening that form from prior inflammation. There's a 2% over-the-counter formulation. You can get a 4% by prescription. And you want to avoid using this longer than 6 months. If patient use especially high concentrations for long periods of time, you can get a paradoxical darkening or even this odd, blue-gray pigmentation of the skin. So something to use. It's great and it's effective, but you proceed with caution. And 5-fluorouracil. This is for patients who are, familiar with coming to the dermatologist, or perhaps you had that family member who did that treatment that caused a lot of crusting and scabbing on their face. So this is used medically to treat actinic keratoses. These are precancerous lesions that, if left untreated for several years, they can develop into thicker growths called squamous cell carcinomas on our face, typically, but anywhere on our body. But they're very common on the scalp and on the face, most typically in patients on the forearms and dorsal hands as well. So the 5-fluorouracil is actually topical chemotherapy. This absorbs into rapidly dividing cells and it causes crusting and scabbing. So you do go through a treatment. During the treatment, you get a decent amount of crusting. I'm going to show you an example here. So this is, a prime example of a patient, and actually the actinic keratoses are these pink rough areas. Sometimes you can feel them better than you can see them. And you can see 1 week into treatment, decent amount of scabbing. At the end of 4 weeks, a lot of scabbing. So when we're trying to talk to our patients about this, they're very leery. Like, what are you telling me that I'm going to go through? They call us 2 weeks in and they're like, well, my skin looks pretty crazy right now. But after 3 months of treatment, not only did we, treat those precancerous spots, but this patient also got a nice improved, appearance of the complexion and smoothing of the skin. So this is something that I just want to encourage patients who have a history of skin cancer or precancerous spots that's been identified, or you're concerned about red scaly spots on your face, have them evaluated by your dermatologist and see if you're a potential candidate for this treatment, especially if they're in wide areas like the entire forehead, the entire cheek. We usually use this to treat a whole area, but it's not something to be used just for cosmetic reasons. Now we're going to shift into more of the procedural options. So when we talk about procedural options, first we're going to start with chemical peels. And this is really getting more expedited results. This is when you want, a faster improvement. Typically with the next couple of treatments I'm going to talk about, these are out-of-pocket expenses that are not recognized or covered by insurance. So with chemical peels, there's a slew of different ingredients you can get in a chemical peel. And typically in medical offices, you're going to have higher concentrations and, the option of more aggressive peels as compared to things like med spas. You also want to be in the hands of somebody who's experienced. Chemical peels is not something to take lightly. It's very important to have the right kind of peel for your skin in terms of color and type of skin. You also want to be sure that it's not going to be too harsh on your skin and that you're going to tolerate it well. So the result depends on the type and depth of the peel. Results are typically improved with repeat treatments about 4 to 6 weeks apart. And before and after a peel, you only want to limit your topical regimen to moisturizers and sunscreens so that you're prepping your skin. It's nice and moisturized for the peel, and then you're going to be protecting it for 2 weeks after. So it's not just something to schedule on a whim and go ahead and have done. But you can see here's an example of a glycolic acid peel. So this is at much higher concentration than what's going to be available in that over-the-counter product. Again, this is an alpha hydroxy acid, and we refer to this as the lunchtime peel because there's less downtime. So you get really nice brightening, exfoliating, and rejuvenating. And often, patients have a little bit of scaling for about a day or two. They have some redness and swelling, usually 24 to 48 hours after the peel, but it tends to be really well tolerated. I had a patient this week who said, yeah, I did my peel and then I went back and I did my Zoom meetings that afternoon. I was a little pink, but nobody noticed. So it's great if, you just want to, come in and have some lightening, some brightening, but not a lot of downtime. Trichloroacetic acid peels. These are some of my, favorite peels, but this is not for the faint of heart. You get what's called frosting with these peels. So we can apply a couple layers, and this goes from a level 1 frosting, which is just a little pink discoloration, to a full-blown white sheet. And what's going to happen is that white discoloration actually lasts for a couple hours, usually about 6 to 8 hours. And then it starts to fade and you get a sheet-like peeling for the next week and up to 2 weeks. So there's more downtime, but you do get great results. And this is really good to target darkened patches on the skin or sunspots. And again, you get the best results with repeat treatments, but you have to be prepared. It does burn for a good 3 minutes as it sets in. And then it's something that kind of, once that 3 minutes is up, the sensation of burning and tingling fades. And the last example I'll give is salicylic acid peels. These tend to be clarifying. They're great for rosacea, acne, oil buildup, tiny little superficial white bumps on the skin that we refer to as milia. So this is really good also if patients are having difficulty with their acne and they have an upcoming event that they want to get their acne clear faster than their topicals are doing. A chemical peel is great. You usually want to schedule at least 2 to 4 weeks out from any major event, though. Now we're going to move on to more of the hands-on procedures that you can have done for your skin. So microneedling is becoming more and more common. And microneedling is nice because it uses your body's natural wound healing processes to enhance the skin. So what it is it's a little device that has typically about 12 tiny needles. And so this is run across your skin. You are numbed with topical medicine for a good 20 minutes. But after treating the entire face, this creates thousands of microchannels. So you have these tiny little openings that you really can't see with the naked eye unless you're looking with a magnifier. And then those heal over. So it stimulates the body's natural wound healing. You get skin cell turnover at superficial depths, and you can increase the depth of the needle up to 2.5 centimeters to really get at deeper depths, which help with collagen rejuvenation and things like scarring. So it really offers lightening and tightening, and microneedling tends to be much more cost effective relative to other more advanced techniques like laser treatments, with a similar concept of stimulating that body's natural wound healing response. Keep in mind that only a physician can treat depths that are effective for deeper scars and texture change. Med spas are usually limited to 1.5 centimeters. So you can get a little bit of rejuvenation, but if you really want to get full texture change or, target some deeper wrinkles, it is important again to go to a physician for these kind of treatments. So here's a couple examples. And again, let's talk about realistic examples. So with microneedling, you can get about 50% reduction of deeper scars. And this example shows deeper, almost ice pick scars, which are tiny little pinpoint scars that tend to go deep. So these are some of the hardest scars to treat. So this patient the skin isn't perfect after a couple treatments, after 2 treatments here, but it's much improved. And typically we do give 4 to 6 treatments for scarring in particular. Here's a couple other examples, though, of more superficial scarring, and you can see the improvement in the complexion. You can see that the skin tone is a little bit more even, and that there is a reduction of fine lines. And I just had a patient the other day, we're treating her acne scarring, and she said, what's been great about this that I didn't, know was going to be an advantage was that my forehead wrinkles have actually lessened a little bit, because we do, treat the whole face with this device. And so it's nice. It relies on your body's natural ability to enhance your complexion. Now, Botox. Most of you have heard about Botox, have a friend who's done Botox, know about Botox. And so it's all over the media. It's in all of the cosmetic magazines. So, I had to touch on it tonight. And Botox injections, this is something that you don't want to go to where it's offered the cheapest. You don't want to go to somebody who's inexperienced, because you are dealing with a toxin that's being injected into your skin in a very controlled way. But you want to be in the hands of somebody experienced. And what Botox does is it is absorbed into your muscles. So it basically decreases the muscle's ability to fully contract. So the muscle fibers on your forehead actually run up and down. So when it contracts, it creates those horizontal lines. So when you inject Botox into that muscle, it's not going to contract as effectively. So it's going to lessen the appearance of those forehead lines when you try to make that expression. So that we talk about the formation of dynamic wrinkles, meaning the wrinkles that are apparent only when you make the expression. So the idea is if you treat these dynamic wrinkles, it also prevents their conversion into static wrinkles, which are wrinkles apparent just at baseline without even making an expression. Now there is this seeming trend towards baby Botox, where if you get it in your 20s, even if you don't have wrinkles, this is going to prevent the formation of wrinkles in the long term. This is a little controversial, and I think that's a pretty aggressive stance. I think if you don't have a concern, don't be kind of pressured into getting something done sooner than you need it. And realistically, it has to be when you're ready. If it's becoming a concern to you, that you're really noticing it, that it's bothering you, and you want to go towards these types of treatments, Botox can really help, reduce, especially the appearance of those dynamic wrinkles. So again, now we're looking at the horizontal wrinkles here between the eyebrows, and these muscles above your eyes, they actually contract horizontally to create those muscles. So when the Botox is injected there, it's going to prevent the ability of your muscles to contract horizontally, and it's going to prevent the formation of those wrinkles. Botox tends to be effective for 3 to 4 months. And historically, what was happening is people were using super high concentration of Botox and people were looking frozen. Nowadays, we've gotten away from that trend. We're using more dilute forms of Botox so that you still have the ability to express yourself. And you can specify this, if you go to a board certified dermatologist or even plastic surgeon for this kind of treatment, and you can say, I don't want to be frozen. I think the good thing is we're getting away from that. And you can say, I still want to be able to express myself. I would still want to raise my eyebrows or, smile, and for people to see that. Especially with our masks nowadays, it's so important to be able to show that we're smiling as much as we can with our eyes. So you can talk to your provider about how much of an impact you want the Botox to have on your ability to contract your muscles. And again, it takes a full 2 weeks to take effect. So it's not like you're going to have the injection and be immediately frozen or changed right after you walk out of the office. So just to review, Botox can target the glabellar lines, which are the vertical lines here. It can treat crow's feet. Those are the two FDA approved indications. And we often use it off label to treat forehead wrinkles as well. Now, cryotherapy, if you've been to a dermatologist, most of you have seen this. This is a liquid nitrogen. It's extremely cold. And so basically what we're doing with this is we're using targeted treatments to freeze superficial cells. So we use this a lot for warts, for those seborrheic keratoses that I noted earlier in the PowerPoint here. And you can even use it really finely to treat sunspots. So this can be a more cost-effective cosmetic treatment, especially if you only have like 1 or 2 spots that you really want to target. If they're irritated, a lot of times, for example, warts and seborrheic keratosis, this is something that can be medically covered. But if it's truly for cosmetic reasons, you can ask your provider what kind of out-of-pocket costs would be associated with the treatment. Now we're going to shift more towards advanced techniques and devices. So intense pulse light, IPL. A lot of people have heard about this. This is one of the standards for photorejuvenation. So this really treats redness and it treats pigment in the skin. So it treats those sunspots. It can also treat rosacea, enlarged vessels on the face. So these are a couple examples of before and after. This is one treatment, 3 treatments, 2 treatments. So everybody's a little bit different with how quickly they're going to get to their end result. I can't emphasize enough the importance of being in the hands of somebody who's experienced, because everybody's skin type is different. And that's going to change the settings that we use on these devices. You also change the settings based on what you're targeting. And with intense pulse light, patients can get burned. And if you're in the hands of somebody who's inexperienced, or if you go to the cheapest place possible to get this done, you may not get the best results. You don't want somebody who's just plugging in standard settings. You want somebody who knows how to enhance the settings based on your skin type, and also, of course, to protect, safety aspects of doing these kind of treatments. Now, laser treatments, this can be a whole, a lot of these separate little topics can be a whole hour-long discussion, but laser treatments, very advanced techniques. The whole idea behind lasers is that you have less downtime, that it's very targeted, and less chance of scarring, less chance of bleeding with these kind of treatments. So there are lasers that have very small spot sizes that can target tiny things like sunspots, blood vessels, tattoos, cherryangiomas. So you have things like pulse dye laser, KTP laser, and pico laser. And pico laser has a it's a nice small spot size, and it actually delivers energy to the skin to help disrupt pigment. And so that's how a lot of these work in terms of reducing pigmentation or treating tattoos. You also have lasers that have larger areas that device is going to treat. So larger tips, we call it, or spot sizes. And basically, these can be run across larger areas of the skin. There are non-ablative or ablative resurfacing techniques. So what that means is non-ablative is actually going to go through the epidermis and really target the dermis without disrupting the epidermal layer. So non-ablative techniques typically have less downtime. You can recover quickly from these, and you can get nice skin tightening and rejuvenation. Ablative resurfacing techniques, you are going to get that disruption of the epidermis. So there's going to be more obvious kind of peeling, more downtime associated with these treatments, but they tend to be a little bit more aggressive. And, some will say that they think that these offer, a better outcomes for things like scar treatments. But really it depends on your finances and how aggressive you want to be with your treatments. And so this is just a picture showing that the lasers can deliver basically heat columns. So if you thought about the microneedles, we're using tiny little needles. Lasers actually deliver columns of heat to do the same kind of thing, stimulate the body's natural wound healing processes to rejuvenate your collagen for those resurfacing lasers. A couple more things to cover. So hyaluronic acid fillers. What is hyaluronic acid? This is a glycosaminoglycan. So again, a nice large molecule that binds and retains water, and it's naturally found in our dermis in between collagen bundles. So it offers that cushioning for our skin. It's also found in eyes and in joints. And so when applied topically on the skin, it creates a hydrated and plump appearance. But when it's injected into the skin, it can help, with that volumizing. We talked about the fact that we have fat atrophy over time. So hyaluronic acid is a way of providing, more cushioning and getting that volume back. So it's commonly injected in the cheeks. It can be injected in the nasolabial folds to offer a little bit of tightening and give that volumization back so that the appearance of wrinkles, the skin can be a little bit stretched to reduce the appearance of those wrinkles. What I really want to warn about hyaluronic acid fillers is overdoing it. So Kate Hudson is one of my favorite actresses. She's been one of my favorite actresses since I was, a young teenager. And I saw this picture on Instagram and I thought, oh no, she got in the hands of somebody who's more aggressive and she's overfilled in her lips and her cheeks here, her skin's really stretched. So, if you're going for this end target, your wrinkles are less, but you're starting to get to the point where your appearance may start to look a little bit more enhanced or unnatural, especially when you're expressing yourself. And we're seeing a lot of celebrities with this. And I was laughing to find out that actually this is an Instagram filter. And this is not what Kate Hudson looks like, but this is a filter that any of us can apparently download and put on our face to see what we would look like if we had these kinds of, more aggressive cosmetic treatments. So I really emphasize starting conservatively, avoid overfilling. Because if you think about it, if you're really stretching your skin unnaturally, this can create puffy unnatural appearance, but it also, once that filler goes away, because typically they do go away anywhere from 6 to 12 months, the skin may then have almost like an increased stretching, a decrease in elasticity, and you may run into more problems down the road. So you don't want to overfill your face, and you want to be in the hands of somebody who's experienced and with you on getting those natural results. I want to run through just a general idea of expenses because, I know we talked about the fact that a lot of these treatments are out of pocket. But topicals, I wanted to empower you to now know what to look for in active ingredients. You can even Google search the active ingredients and look at the range of prices. You don't have to go for the most expensive, topical now, because you're going to know what that active ingredient is and what it does for your skin. With chemical peels, they typically run about $200, but prices can range anywhere from $150 to $300, especially for more aggressive peels. They're going to be a higher price point. Microneedling is typically $350 to $400 per treatment. Botox, if you just treated one area, for example, the glabellar lines, usually about $200 to $250. If you treat all three areas, meaning the glabellar, the upper forehead, and the crow's feet, that can run about $600 to $700 per treatment. And if you get, even more treatment areas that are off label, some people will do the little bunny lines on their nose or around their mouth, the expense can increase. Fillers tend to be $650 to $700 per syringe, and I typically do not recommend people getting more than really one, max 2 syringes on their first visit. IPL treatments can be $300 if you're just treating, portions of the face, up to $500 for the whole face. And then laser treatments anywhere from $150 if you're just really treating 1, 2, or 3 spots, up to a couple hundred, sometimes like $700 to $1,000 even for full face treatments to get that reduction of wrinkles. So, the more advanced the technique, these devices are expensive. So the cost associated with doing the treatments is higher. And typically, because you need more treatments than just one, there's packaged pricing. So typically patients will get 3 treatments and that will offer a reduction in the pricing to make it more affordable. Don't feel pressured to spend hundreds of dollars on your appearance. Again, I emphasize, the importance of topical treatments to help prevent and enhance your skin health. So experience matters. You want to make sure that you're going to a board certified dermatologist or plastic surgeon, or somebody who's experienced in doing these treatments, somebody who's patient centered, trustworthy, with a good reputation. So if you're new and you're looking where to start, I say start with a skin check. Make sure you don't have skin cancers or precancerous spots, and get a feel for the doctor or practice. Make sure that they're concerned about your health, and anything that might be more cosmetically oriented. Make sure that you're comfortable, coming to that physician knowing that they have your health and safety first and foremost in mind. Also, don't start with 10 products and get excited and just start, throwing things off the shelf into your shopping cart. Really start with 1 or 2 new products. Give each product a good 4 to 6 weeks to kick in. And if you're interested in treatment options, you can always call the front desk of an office. You can ask about finances over the phone. You can set up cosmetic consultations to have in-depth conversations and come with questions prepared. And lastly, if you're new, don't feel pressured into doing anything. Don't rush because of time constraints. Review contraindications with providers to make sure that these are safe treatments for you, and be aware of any downtime. So again, we're not doing any last minute scheduling. You're really going to understand what you need to do to take care of your skin after these kind of procedures. So remember that we all age. We don't have to spend thousands of dollars to enhance our appearance. Starting with sunscreen, vitamin C, and retinoids is a great place to start, and sun protection is key. So I'm going to go ahead and stop sharing.
Yes, thank you so much, Dr. Jones, for an extremely informative and detailed presentation. As I just shared with everyone in the chat, I know that we've come up at 8 o'clock, but for those of you who are attending and can stick with us, we'll try to get to some of your questions, or at least address some of the themes. I know we covered a lot tonight, and a lot of your questions that you sent in advance were included in Dr. Jones's presentation. If you missed any of it, it will be available tomorrow on the Jefferson Alumni YouTube channel, and you'll receive a link in your email. But if you'll stick with us, we'll just answer a few of the common themes that are still in some of these questions. And so, Dr. Jones, one of the questions and one of the themes that really stands out in the questions that we've received relates to diet and diet's effect on skin, things like dairy, things like water and sugar and the like. Can you give a little synopsis of your thoughts on that impact?
Yeah, absolutely. Diet was studied about 50 years ago with the skin, and people were starting to be more concerned about dairy products and the effect of dairy products on the skin. And there were early studies that were done that suggested specifically skim milk. For some reason, the formulation of skim milk seems to have an inflammatory effect on our skin, and we see acne flaring with skim milk. So that is a key thing. It kind of went, things were quiet for a while, and then it came back in the literature recently. And in the past 15 years, this is something that's been actively looked at, and we're getting more and more data to show that diets high in skim milk, for some reason, it seems to be more inflammatory on the skin. The other thing is high glycemic index diets. So diets that have a ton of empty carbs, a lot of sugars. We're seeing a lot of, again, inflammatory effects on the skin. So it's affecting acne. But we also see people who tend to start to develop insulin resistance and gain weight. They're getting things like hyperpigmentation of their neck and skin tag formation. So this is an area of research now that's very active. We're starting to understand that diet does have an impact on our skin and our overall health. So I always recommend a well-balanced diet with exercise and de-stressing techniques where possible, in all of our busy schedules, ideally, but diet can be a first place to start, especially if we're busy and can't get that exercise in, with plenty of fruits and vegetables.
Thank you very much. And another theme that we see relates to sort of a common thread, especially when we're talking about aging, and it's things like firming creams, anti-wrinkles, serums, collagen supplements. Do any of them work?
Yes. So a lot of what's in the firming creams is actually a retinol. So we talked in depth about that. And then collagen supplements, this is another huge question. So we found that applying collagen topically on our skin, it's not really well absorbed. We found injecting it, this actually has, it's not as advanced as the hyaluronic acid fillers that I talked about. So those tend to be more effective with less side effects and less risks than the collagen fillers. So now people are saying, well, can we just go ahead and take an oral supplement of collagen? There are about four, you know, blinded placebo-controlled trials of about 60 patients total that are indicating that there can be some enhancement of thickening of the collagen and the improved appearance of skin hydration with oral collagen supplements. But really, the jury's not out because there's no indication that if we just take collagen orally, that it somehow knows to go to our skin. So, a lot of scientists are saying, well, if you just have a diet that's again well balanced and you have good protein intake, you're doing the best for, collagen health of your skin. And there's nothing to show that by ingesting collagen, that's going to be superior to just a healthy diet again. So I think that's again an area of active research. There's a lot of hype and a lot of marketing. There's no standardization of the ingredients of collagen, even in the studies that we've seen. So it's not something that I routinely recommend for my patients yet.
Thank you. We also have some questions really related to more sensitive skin. We even have a specific question about dermatitis and periorificial dermatitis and sunscreens and other products. Do you have any recommendations for looking for things that might be more gentle for someone with sensitive skin or
Mhm.
sensitive eyes? I know for some people, sunscreen can really irritate their eyes.
Yeah, so for sensitive skin, moisturizing is key. Again, an oil-free moisturizer and moisturizers with that dimethicone it's great for sensitive skin. Niacinamide can help reduce redness and irritation if people, tend to get a lot of that with different products that you're using. So it can help with the tolerability of products. And sun protection. Again, everyone with sensitive skin can benefit from that. But we did go through each of the ingredients, and it's always starting slow too if you have sensitive skin, and not overdoing it by starting a new regimen with 5 different products. And also avoiding those toners, alcohol, witch hazel. None of that is good for any skin really, but especially sensitive skin.
Excellent. Thank you. We have a question very, very timely and related to this time, related to mask wearing and
Yeah.
skincare. Any advice for prepping your skin or cleaning your skin or just avoiding what we like to call maskne, if you will?
Yeah, it's been a huge concern. So it's maskne and it's also just dermatitis and inflammation from the masks because we're seeing that with a lot of the medical grade masks, first of all, the N95, there can be metals, there can be rubber in there, but there's even things like formaldehyde and preservatives that are leaking out from the masks onto the skin. So this is causing inflammation and acne, but it's also causing almost an eczema-like reaction. So we recommend, people, especially people who have to wear masks for long hours, trying to take at least a 5-minute break every 2 hours. How realistic that is, it may not be. I know like these surgeons who are in the ORs for hours and hours, they're struggling. You can use a little hydrocortisone if you don't have acne and you have more itch and irritation. But moisturizing is key, right before you put the mask on. And for acne, just maintaining your normal acne regimen, seeing the dermatologist if you're flaring. Retinoids are great for that. But the minute you take the mask off, trying to just wash with a gentle cleanser to get that oil buildup and that moisture buildup off your face. These can help. It's not a perfect solution as long as you have to continue to wear the mask, but these can really help reduce those kind of effects.
One more question is related to different skin makeups, skin tones, and any different advice that you would give or any specific symptoms that someone might want to be aware of, say if they had African American skin or other complexions.
Yeah, this is a great question. And the one thing is sunscreens nowadays, you're seeing that a lot of these sheer formulations, even in the zinc, they're not leaving that cast on the skin. So it's great for all skin types. Um, there's somebody on Instagram, it's called Brown Skin Derm. She's a great resource for people who are skin of color. I think she just graduated from residency, but she's got a great following. She has, recommended products for skin of color as well. And, there are certain things like the glycolic acid is great for lightening and brightening and safe for darker complexions. And again, if you're going to some of these laser treatments or you want some of that resurfacing, you really have to be in the hands of somebody who's experienced because the last thing you want is either hyper or hypopigmentation, meaning pigment loss. from some of those kinds of treatments. But there are great resources online, and the market is ever expanding for accounting for all skin types.
Well, I think that we covered many of the main themes, and if we didn't get to your question, I know that um, Dr. Jones can be available, and we'll try to get some additional answers from her. But we want to once again thank you, Dr. Jones. This was a very, very informative talk and with great questions, and we want to thank everybody who's joined us this evening. We do hope that you'll join us for one of our other upcoming programs, or more than one. Next week or later this month, we have financial planning. This is with alumnus Mike Zimmerman, and he's returning by popular demand to continue his financial literacy series. Then in June, a panel of Jefferson experts will share tips you need to know whether you're a veteran runner or just getting started on June 16th. And the Jefferson College of Nursing will continue its Visiting Scholar series with joining forces with veterans and families at noon on June 24th, and continuing nursing education credit will be available for those who qualify and attend. And lastly, be sure to sign up for the Jefferson Alumni Network, our brand new community for Jefferson, Textile, and Philadelphia University alumni, where you can update your profile, search for classmates and fellow alumni, and make new or renew connections. Activate your profile now at alumninetwork.jefferson.edu. Thank you once again for joining us. Everyone, take care and have a wonderful evening.